I want to talk about developmental trauma, and I want to talk about it and its relationship with shame. Before I get started with this, I want to highlight the discrepancy per Brene Brown between shame and guilt. Shame is I feel bad about who I am. Guilt is I feel bad about what I do. In my almost 14 years, no, it's been 15 as a 16 as a clinician, but 14 years at the Healing Collective, what I deduce is most adults do not recognize shame. It's the most primitive emotion we have, and it's the one we don't recognize. I, too, include myself in that bulk of humans because it's survival. So I invite you, even if you feel like you have a really good grip on shame, and I hope that you do, please prove me wrong. I invite you to see what comes up for you tonight in this topic. When you think of a nurture wound, I want you to think of that synonymous with a basic need. If you've worked with me or my team for any amount of time, you know Maslow's hierarchy is huge in how I treat relationship with me and me. It is not about the relationship with me and someone else. Maslow's hierarchy at the HC is about my relationship with me and how I show up in that relationship with me. So when you think of the very bottom of that hierarchy, it's okay if you don't remember 7th grade PE class, I'll remind you. If you think of the bottom of Maslow's hierarchy, basic needs are food, shelter, water. And then right above that, the second step on the ladder is emotional. In order for someone to be emotionally available, those two steps must be fulfilled. I want to highlight that this is not about blame and fault. This is not about what my parents did to me. And if that's where you are in your story and you're stuck in some blame, no judgment here. That's just where you are in your grief process. And my intention of sharing this is not to beat up anyone. It is to highlight what a nurture wound is, where it comes from, and when it goes unhealed, what does it look like? A nurture wound is when I had a basic need, it was an inconvenience. That could look like when I was hungry at any age, infancy to, I don't know. For some of us, we weren't allowed to get our own food. We had to ask for it. So it can be into young adulthood. When I'm hungry, what response did you get? As a baby, were you aware that you had to wait for a schedule? Were you told that you were put on a certain schedule? Or when you were young, did you have to wait till snack time? If you were hungry, did you have to eat what was offered to you or options? And when you were hungry, did you get to choose how much you ate or did you have to clean your plate? I want you to think about the basic need of hunger and how was that need met or not met? What message did you get from that? And was it any type of inconvenience? One that comes up frequently for me is when we were on a car trip or a car ride, not only was it, I'm hungry, it was also, I have to go to the bathroom. And boy, if it was not a pit stop time, we didn't stop. So it was a huge inconvenience. How about as a little one, what happened when you were scared if you couldn't sleep at night? Were you allowed to go in and get cuddles? Were you allowed to sleep with your parents, with your siblings? What happened? Were you sleep trained? No judgment. Not blaming. I just want you to notice. And I want to invite you to please stay in your story. Please don't go to you as a parent. I'm asking you to stay in your story. How about when you were hurt? What happened? If you fell down, what did caretakers do? Oh, do you need an ice pack? Oh, let me get you a Band-Aid. Did you hear the ambulance song? Because I'm a real dork, and that's what I do still to my 10-year-old and 8-year-old. To the rescue. What was it like for you? Was it an inconvenience to caretakers when you were hurt? Any kind of hurt. Hurt feelings, physically hurt. How about when you were thirsty? Could you get a drink whenever you wanted to? And what about if you accidentally made a mess? If you knocked something over, if you spilled something, if you were being a kid and it was just an accident and you made a big old mess, what happened? This is a big one for my body, which is why I took notes as this came up for me today. The last one I want to mention is what happened when you were sick? If you were sick and you were supposed to go to school or mom or dad were supposed to go to work, what happened to you? Were you loved on all day and taken care of? Cuddled, snuggled, homemade chicken noodle soup? What happened for you when you were sick? These are what I'm calling nurture wounds. I want to ask that you check in with your body. This is why I gave the caveat at the beginning. And I want to invite you to trust me. When we have nurture wounds, in the moment, for many parents, there is a denial that it's real, a denial that it's actually that bad, a denial that you're really not that thirsty. You just ate or drank 2 hours ago. You're fine. Your throat really doesn't hurt. Let me see it. Deny, deny, deny. Avoid. Okay, just take this Tylenol and go to bed. Any version of this, whatever it looked like for you, whether it was something that was done to you or something that you needed and never got, those are the same thing. I want to invite you to consider what this nurture wound looks like as an adult. Self-loathing, self-harm, self-judgment, self-shaming, and fantasizing about an escape hatch. What do those mean? Those look like, and I have a lot of therapists that ask for a lot of help around this because it's very triggering. Those look like victim. They look like Amber, my client, my fellow traveler, my sister, my mom, whoever is really showing them. And it's irritating. It's frustrating. I, self-assessing, am like, oh my God, stop being such a fucking victim. Oof. I want to invite you to consider options of what those things look like, as many, many things in our culture is victim blamed and minimized. Self-harm absolutely is what many of us consider it. It's where I use something to physically harm my body. Self-harm is anything that causes me pain, emotional or physical. I can be very abusive to myself, even just through my critical parent, not just, I take that word away, as in with my critical parent. Very neglectful. I would be really, really proud as a nursing student that I could work 2 8-hour shifts, 16 hours straight and not pee. I would be proud of that. Like it was a joke. that I would get the gold award for the strong bladder. Think about those basic needs. And as an adult, what do I do when I have needs? Do I deny, deny, deny? Do I avoid? Do I ignore it? Do I minimize it? What happens for us when we suffer from nurture wounds and developmental shame is I do to me what was done to me. So I attempt to shame the shit out of it right out of me. I don't really need to pee. I'll be fine. I can wait till I get home. I'm not really hungry. I'll have dinner ready in 2 hours. I'll be fine. I'll just wait. I think if I don't have fever tomorrow, then if I have fever tomorrow, then I'll go to the doctor. This bargaining, this negotiating, this if it's really that bad. Who the fuck am I proving this to? There's no Amber police. It's just me. I am all the roles. And then I'll ask to myself when I notice I'm in victim, I'll shame myself with, sorry, I can't do two things at once, guys. I'll shame myself with, why? What is wrong with me? Why? Why? If you work with me or any of my team, or if you've ever done any systems work, you know why is on our guidelines. And it's crossed out because why places blame. Why am I doing this? Says I'm doing something on purpose to myself and it's my fault. If I say to my 8-year-old that spilled his water cup on the dinner table, why did you do that? Well, he didn't fucking do it on purpose. I mean, some kids do, and that's a whole different scenario, but it's usually still not their fault. And why places blame? When my self-talk says to me, and I'm in victim, why means it's my fault. That's old. The reason that it's old is because when I'm a child and my basic needs are an inconvenience, I internalize. It's my fault I didn't go to the bathroom before we left. And I didn't know we were leaving and we were going to be gone for 3 hours and I'm 8. But it's my fault. When children don't have context, it is natural for them to self-blame and internalize. That is nurture wound. And as an adult, if that nurture wound is not healed, that looks like an adult that still internalizes. Everything that happens, somehow it's my fucking fault. And the reality of blame and control is there's only 2 options. It's either going to be your fault or it's going to be my fault. And when we're in recovery, what we know is there's a whole shit ton of options between those 2. But in pathology, it's your fault or it's my fault, but it's going to be somebody's fault. And I would much rather it be mine because I don't want to hurt you. When I'm in victim as an adult, something is wrong with me. But my adult self isn't the one hurting. My little one is. And I'm hoping what you're picking up on is I'm doing to me what was done to me. When I'm sick today and I say, if I still have a fever tomorrow, then I'll go to the doctor. I'm proving it to somebody. It's got to be bad enough. I'm doing to me what was done to me. And I could be wrong, but I'm pretty sure that parenting style didn't work. Obviously, because I'm still stuck in it. So, as an adult, what do I do now when I have a basic need? I'll eat in a couple hours. I'll have dinner ready in a couple hours. I'll pee when I get to the next store. I'll check my blood pressure tomorrow when I go to CVS. I ignore, I shame, I deny, I threaten, and I bargain. Those are the things that I do with myself, trying to avoid fulfilling a need. As long as I do to me what was done to me, I'm going to stay stuck in that cycle. And what will happen as an adult, this is an Amberism, so you can disagree with any of this, and I encourage you to reject it if you disagree with it. And in my 20 years of recovery and 14 years as the owner of the HC, I'll tell you exactly what happens when we stay stuck in that cycle. It's called disordered eating. It's called substance use disorder. It's called codependency. It's called exercise addiction. It's called porn addiction, sex addiction. You might be getting my point. Like, I can keep going and naming them. Gambling, video game addiction. The whole point of this is to show the root of all of those things that our culture calls addiction is trauma. And it's all based on an unmet need. That as long as I keep doing to me what was done to me, that fucker ain't gonna get met. I mean, that parenting style just, it's not working. It is not creating the solution based on the need. But yet we keep doing it. Does that blow your mind? Because it sure fuck does blow mine. And I know you guys know this, but I'm going to say it anyway for the recording. I work with really smart fucking people. Like, they run companies. They're doctors and nurses and attorneys and like really highly successful people. And I kind of think I'm kind of smart. And boy, did I stay stuck in that cycle for a really long time. Doing to me what was done to me does not relieve me from the pain, especially when it comes to developmental trauma in relationship with shame. If my trauma is rooted in shame, and I will argue that many of ours is, if I use shame on me the way shame was used on me, I will continue to suffer. And I will find relief, as I frequently will say, I'm absolutely a fellow traveler. I am absolutely an addict. And today I'm just no longer suffering. And that's thanks to my recovery program. So there is solutions, but we can't do this alone. And we sure as hell can't do it if I don't even know that I'm doing it, because none of this is intentional. It's the blueprint that was offered to me. Thank you for trusting me, and thank you for allowing me to facilitate this level of awareness, because there's a really powerful defense mechanism that allows us to stay stuck in this. And I'm going to use the example that I grew up with, not because that's the only one, and just for sake of time, so it can color it in for you and you notice the one that you were offered. As a little girl, I grew up in a home of dysfunction. My addiction ruled my family, and the biggest one that I saw for most of my childhood was alcohol. And the way the denial showed up in my home and how I was taught to deny was from a very young age, I would count how many drinks he had, because I knew what the line was. I knew when it would get dangerous. And my mom would depend on me to tell on him. And so she would say, Amber, how many did he have? And I would say, I don't know, 6 or 8. And he would say, I had 2, with the most convincing, reality-based, factual talking anyone could possibly do, to the point that I would really question my own judgment. That was denial. The reality versus what he wanted to believe. Now, were there times that was manipulation? Abso-fucking-lutely. Excuse my mouth if you're new. Abso-fucking-lutely, that was manipulation at times. And most of the time, it was not. That is truly what he believed in his body, because the reality was too painful for him to acknowledge. Now, in our culture, denial is thought a lot of as manipulation. And denial as a defense mechanism is not. It is a true belief that this is what I'm doing, and this is how much I'm drinking, or this is how much I'm using, or this is what's happening in my home, or this is what's not happening in my home. And if you've worked with my team and you've done our stabilization, our second stage of treatment, the majority of that treatment stage is getting you back in your body. And there's a reason for that. Because when we live in shame, it's number one, really hard to be in our body. And when I do to me what was done to me, what I'm doing is shaming. I am self-harming, whether that's through abusing myself emotionally, mentally, physically, through substances, through behaviors, exercise, however that harm, what I'm doing to me, if I wouldn't do that to another person, that's self-harm. So I want you to think about that. If the way I treat myself, I would not do that to another person, child, adult, anyone, then I want to ask you to consider the definition of that as self-harm. When I do to me what was done to me, I shame me. And I depend on denial to survive that. Was I mad at my dad because he was lying? Yes, of course I was, because I knew he had way more than he was admitting. But there's a part of his brain that needed to believe that, and it really was not manipulation many of the times. Today, as an adult, when I'm in victim and I'm telling myself, I can do this, I can go 2 more hours, I am denying my reality. Am I going to die if I don't eat in the next 2 hours? No. But am I self-harming? Yes, I am. Am I going to die in the next 2 hours if I don't eat? That's me trying to prove something to myself. That's me saying all or nothing. When my body is hungry and I force it to wait, there's a problem with that if it's a pattern of behavior. I am denying, I am shoving, I am numbing, I am medicating. That level of denial is just like looking at, I meant to have one of these to pull up and I forgot, I'm sorry. When you look at a picture of illusion and there's more than one picture in it, that is you seeing one and me seeing another. The reality is we're both right. And that's very similar to denial when I can only see it one way. A big part of what my team is doing is helping you cope with your story through a lens other than shame. How do we do that? Well, this is one of the ways. Number one, you're supportable. Number two, you sit through and listen to the hard things and you gain awareness of what is your story and what's not your story. I say all the fucking time, if this doesn't pertain to you, that's a good thing. Reject it if it's not yours. That's good. And unfortunately, oftentimes in these settings, there is a version of what I'm saying that most people can connect to. It's not my story, and that's fine. And what connects us is the emotion, not the details of the story. How we got there is going to be different, but what the outcome when we got there is the same. So when we are doing to me what was done to me, when I shame me, I go into a state of denial. I deny that I have needs. I deny that I have basic needs that aren't being met. And when I'm going through stabilization, when my therapist, I'm starting to get back in my body. I'm starting to use a different lens that doesn't use shame, that allows me to have as much importance or worth as others. Think about that. Are you as important as others? I'm not asking you to make yourself the priority yet. We can't jump all the way there. But what I am asking you is the way you treat yourself, would you treat your best friend or your child that way? If not, we need to look at it. Oftentimes people will ask me the solution. What's the recovery solution, Amber? Well, first of all, when I'm inflicting my own pain, AKA self-harm, whether that's from denial or from a state of awareness, or partial awareness, that's me stepping into, I got to be able to know what it is and see it and own it in order for me to shift it and change it. That's reparenting. But I have to be able to be in my body first to recognize that is not okay that I'm doing that to myself, because that's the first step. The level of awareness and emotional availability is what creates the shift and the change. In the very beginning, I said there's 2 steps of Maslow's hierarchy. Basic needs is the first one: food, shelter, water. The second one is emotional safety. Those 2 steps together create emotional availability. If I'm not fulfilling my own needs, I'm not going to be able to be emotionally available to myself and reparent myself in a way that allows me to come out of those wounds. That's the solution to developmental trauma. Number 1, we can't do it by ourselves. Number 2, the way we do it is through co-regulation and is through therapy. And number 3, this is a real kicker that pisses some of you off. I was one of these people. It's group. Whether it's this support group or whether it's our group that starts, I think, next week. If you haven't signed up for that yet and all of this is resonating with you, you need to be in that group. And side note, I think we only have 1 or 2 slots left. But noticing what I need and being able to fulfill that, we can't always do that alone.